Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Morning, everyone. It's Monday, April 27th, and here we are again.
It's Monday.
Our COVID-19 community information program that we do Monday through Thursday at 9 a.m. live on KSJE's Facebook page and YouTube channel, and it is rebroadcast on our partner station KNMI at noon and here on KSJE Radio every afternoon at 5 p.m. So, here we go.
Yes, roughly 5 p.m.
5:06.
5:06 to be exact.
Yeah, right. If you're a stickler for details, that's true.
I'm not usually a stickler for details, but
today you are.
There I go.
Okay.
Cool.
Very good.
Do we have numbers?
We do have some numbers.
Okay.
Let me get to those numbers.
Okay, cool.
So,
Cool. While you get to those numbers,
what do you got?
I got national numbers.
Okay. All right. I'll let you talk about those.
Yeah. So nationally, what we have here, and this is from April 26th, so yesterday, fresh numbers. And this is total in the United States. So we have a total of 965,781 cases. And that is up 27,631, up 3% since their last numbering here, which would have been just a couple of days ago.
Okay.
And total deaths now we're at 54,874, which is up 1,126. So
Okay.
that's a lot of cases.
That is a lot of cases, and
Yeah.
things are still increasing, and that's the concern, I guess, that I hear for folks who are talking about reopening some of the parts of the economy, and they'd rather see those numbers maybe try to, kind of level off a little bit before there's a lot of reopening.
Yeah.
But the conversations are taking place throughout the country.
All the time.
Yes.
Yes.
Very true. But we do have local numbers. So from the weekend, and there was kind of a disclaimer by the state about the numbers that came out yesterday. But as of yesterday,
What was the disclaimer?
Well, they don't think all the numbers were reported for Sunday, and so there may be more coming in today. So it may look
It's my lag question.
higher than normal.
Yeah, okay.
But they disclaimed it, so we know. But
Okay.
it's just hard to then compare
Right.
as we're looking at things. So we were plus 66 new cases in New Mexico yesterday, 7 new cases in San Juan County, again, according to these numbers, 6 new deaths in the state, and 2 of those were in San Juan County, 18 more recoveries, and that was kind of the latest from the state. Again, we are going to ksje.com in our news category if you want to look at some of these things as well. That's where we're posting the local stories that correspond to this and other local news as well.
Right.
So that's where we are.
Okay.
And if we scroll down, we can kind of see, again, those daily numbers from the state, and the deaths in Farmington and San Juan County are listed there. The Navajo Nation talked about 97 new cases and 1 additional death over the weekend. And so there was that. And then again,
they're still doing curfews every weekend.
they are doing curfews.
Yeah.
They've extended those curfews, I think, into mid-May.
Okay.
For the weekend, those 57-hour curfews. And so that's still happening on the Navajo Nation. And then I think we'll be talking about this later on in this program, about this free COVID-19 testing that's happening today and also yesterday out at McGee Park for certain groups. And you were out?
I was out there.
Were you there for a certain
time?
I
was, yeah, because I'm going to step in and do some volunteer chaplaincy here, and with one of our local health partners. And so I figured it might be a good idea to just see what's up in my interior. I'm fine. I mean, there's no...
You were there for testing. You were there supportive.
No, I was there for testing. The reason I went for testing, is to say that I'm joining the ranks of sort of the healthcare workers, so that's why I did it.
I
Not
see what you're
because,
saying.
I don't have any symptoms, but, they're frequently saying, particularly people in my age group, that we could be very asymptomatic and still be carriers, so figured it was the socially responsible thing to do, to not expose, particularly... The chaplaincy I'll be doing is with folks in hospice, and so not expose them, obviously, more. But I arrived at 10 afternoon, and so 12:10, and they were testing until 2, and they turned me around because they said, we got to get all these people through by 2 p.m. And so, so that means that the people in the back of the line were going to be waiting for 2 hours. It's pretty crazy.
They were already kind of maxed out. And
they were totally maxed out, yeah.
And so, again, that's happening again today.
Yes,
10
to 2.
Out at McGee Park. And again, we can talk a little bit about the people that are supposed to go out for the testing. It's for certain groups. And so
very specific groups.
And so that was what it's about. And I'm going to call that up here so you can see who we're talking about.
Essential workers, basically. So grocery stores, healthcare workers,
right.
Folks like us who still go out, media.
Right. Folks like
The folks like us, Scott.
the Megan and Scotts
The
of the world.
Megan and Scotts of the world.
Yeah.
Yeah.
Okay.
We're a type of people.
There's a test for us, but it's not that one.
It's not, yeah.
I'm afraid
Yeah, can we
not.
find that test? Whatever that test, where is it?
Yes.
So, yeah, so those are the groups. So it's not for,
There we are.
folks that are physically distancing and
Right.
stuff. It's for folks that have to be out. And
Exactly.
so we're pulling up specifically and experiencing symptoms, of course.
It's on the screen, and it's so again for these groups again at McGee Park today, 10 to 2, for persons experiencing symptoms, of course, essential workers with or without symptoms. So that again
Right.
be the healthcare workers, first responders, public works, grocery store employees, media. Again, those are
media.
those are in that list. People with or without symptoms who are contacts or household members of residents who've already tested positive. So that kind of makes
Right,
sense, right?
right.
Employees and residents of congregate settings with or without symptoms, like nursing homes and group homes and
Assisted
things
living,
like that,
things like
right?
that, yep.
And then anyone who's traveled to any area with community spread in the last 14 days, which is probably almost anywhere. If you were out of town or out of state,
Yeah.
that could be
You're
you.
not safe.
So there you go.
Well, and speaking of symptoms,
Yes.
6 hours ago, just 6 hours ago, the CDC released 6 new symptoms to the list.
Oh.
So we might ask the docs that this weekend, but
We're gonna talk to them.
That was on the CDC website this morning. So,
Okay.
Yeah, most interestingly, loss of taste and smell.
Interesting.
I know that.
Okay.
I want to know why that's happening.
Loss of taste I've heard before as a possible symptom, but the loss of smell is maybe a newer one. But yeah, interesting.
I know.
The more we learn about this thing, and again, that's part of
It
the
gets weirder and weirder.
Yeah.
Yeah.
But that's part of the thing I think about this is that we just don't know a lot about this
Right.
new version of
The
coronavirus.
novel coronavirus.
Right.
Novel, not in that way that we normally compliment people for having novel ideas, of course.
No.
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 Novel in all the wrong ways.
Exactly.
That's right.
With this thing. That's very
right.
true. So the other thing I want to show everybody is something that I shared with you over the weekend about from the New York Times about some lists that unfortunately our area has made it on a nationwide list. And
Yeah.
so let me call that up here in a
Not a good
second.
list.
No, it's not.
Not a good list. This was a list referring to what they consider metropolitan areas, right? So
Yes.
right. So that would be areas like ours, and the one that was highlighted specifically was Gallup, I believe.
Yes.
Yes.
Right.
So
And so let me call up that article. I have
yeah,
to go
and
back
it was
to where we are.
interesting because then other hot spots around the country, like specifically Connecticut and the New York metro tri-state area,
Right.
are leveling off.
Right.
And then there's folks like us, not Megan and Scott, but
Yeah.
our area of the world that continue to surge. So,
Exactly.
which of course is pushing opening up back.
Right. So this is from the New York Times that I'm going to show on the screen here. And again, so for folks who are listening to the radio, we encourage you to go watch the video to see more of what we're talking about. But they are trying to give us more of a big picture about cases and deaths and put it into perspective with population numbers and things like that. Because again, you can have a very small population, but a large number of cases, and that boosts your numbers way up
Right.
compared to even maybe New York City or something. So
Right,
that's what they're looking at.
disproportionate
Yes,
situation.
thank you. That's the word.
Yes,
That-
thank you.
that is
That's
the word.
Is that my makeup call for Nexus?
That's the correct word. Well, you're using the correct word, so I appreciate that. It could be. It could
Yeah.
be. There you go.
Finally,
So
my
as we
debts are cleared.
As we scroll through, we can see, and some of but we're trying to, I want to get to the local numbers here. So there's new cases in the last 2 weeks for the New York City area, but if you take a look at that list on the left-hand
Number
side
4.
of the screen, Gallup, New Mexico is listed as the 4th largest metro or micro area with the highest numbers of new cases in the last few weeks after places in Ohio, Nebraska, Arkansas. But Gallup, New Mexico is just ahead of the New York City area, which is flat or decreasing, but it's said still to be growing because they have 576 recent cases in Gallup. So there's that.
Is that per 1,000 people, 7.96?
Right.
Okay.
So, got it?
I do, yeah.
Okay.
I'm talking out
Right.
loud as I'm
That's
analyzing
okay.
this.
It's math, and I know neither one of our fortes are math.
Mathy Monday morning.
But that's okay.
Disaster.
But sure. So if we keep scrolling down, and you can see, and we'll put this link on with the show after we're off the air. If folks want to go check it out. But
To
then,
the right, here we
if
are.
we go on the right-hand side of this graph, we're showing the highest average daily growth rate of deaths. and we are number 4, Farmington, New Mexico. And that's not a good list to be on.
That's not a good list to be on. That's a bad list.
And so, again, it is showing us, and I will try to scroll it over so we can kind of
Double
see. Cases are
deaths.
doubling every 4 days in Farmington.
Ooh.
And there you go. And again, we are behind North Carolina, Connecticut, Nebraska, which those deaths are doubling even more quickly than 4 days. But that's where we are, at least from the numbers here in Farmington. So we're being ranked on some of these lists, which is interesting in a weird way, because Farmington isn't always included in some of these things, because we're such a small area.
I was going to say, yeah, I didn't know about the existence of Farmington until I moved here.
There you go.
For example.
And then you wondered where it's been all your life.
Exactly.
Right, now that you're here. Mm-hmm. But it's interesting. So we appreciate the New York Times and their graphics and being able to show this and share this with the community and talk a little bit about kind of what's happening.
What's going on.
Exactly. So we are waiting for Jeff Bourgeois to give us a call, and I may just give a little reminder about that.
That'll be good. While you're doing that, so you know me, I'm like way into philosophy and ethics and stuff.
Yes.
Yeah.
Right. Hi.
We met.
Oh, Megan.
Yeah. So anyway, there's been tons of interesting stuff going on NPR. I have basically a personal research assistant out there who might be listening. We call it the personal algorithm that sends me interesting stuff for this show. And so this weekend I listened to, it was like about 8 minutes, and they were interviewing this philosophy professor from University of Alabama. And basically people were calling in with their questions, and it's as it pertains to lockdown conundrums, if you will. And one of those, give you a snippet, was I have this elderly neighbor who's diabetic, so they're at double high risk. And before this, I would go out and buy little, groceries and stuff on occasion to help this neighbor out. The other day, this neighbor asked me for a candy bar. What'll I do? What would you do, Scott?
Oh.
So factor in,
right?
Diabetic, right, is asking for a candy bar. And then this was in New York City, so you were in a hot spot, and this requires you personally to go out and purchase said candy bar. What would you do? So the caller just lied and said made up an excuse, something about why they couldn't go.
Okay.
What would your answer be, Scott?
I might have to go with that. I don't know. I don't know what I would do. I have to think about it a little longer.
I was like, clearly, I'd buy the candy bar, obviously.
Okay.
Yeah, because it's like a nice, pleasurable experience in the middle of like a bad situation,
True.
I would put on a mask and some gloves and get out there and get whatever candy bar this neighbor wanted.
Okay.
Because chocolate makes us feel better.
Well, that's true.
That's also science.
That's true. Well, I guess that's part of it. If you have the equipment to feel protected, then I think you'd feel more comfortable going out.
Yeah, I'm going to throw my PPE on to go get Hershey's. Yeah. And then the other one, this one I thought the professor could be more straightforward on this one. So the question was, you're a caretaker for 2 folks, again, high risk. One of them had ALS and the other had a very complex autoimmune thing going on. Your day job has been to go and cook meals, bring groceries, etc. But you have a housemate who is also elderly, so therefore potentially compromised.
Right.
So what do you do? Scott?
I don't know. Oh, that's another good question.
Seriously?
Really?
Just come up with, just say something. This is a hypothetical situation.
I'm sorry.
For you, it's a hypothetical situation.
For me, it is.
You can't go wrong.
That's right.
What would you do?
I guess I would need to know more about the situation at home. Is my elderly roommate quarantined, or are we just hanging out together, or what's going on?
You're housemates, so you're not in a single room, and so there's some space there.
Right.
To me, it's an easy answer. My job is to caretake for these compromised individuals. I am the only thing they have.
Okay.
With the housemate, it's a 50. You can flip a coin as to whether or not you bring it home and expose them.
Right.
Especially since they say only 5% of Americans they think have been really exposed, which is something we'll also ask later in the week.
That's right. Exactly.
But yeah, so that for me that would be an easy answer.
Okay.
I would go to my job.
Okay.
Cool.
Instead of answering, I'm going to go to the phones.
Great.
So
there you go.
There you go.
You're welcome, listeners.
Thank you.
Yeah.
Exactly. And we'll go to the phones. Good morning. You're on KSJE. Hello.
Oh, Scott, it's Liesl.
Hey, it's Liesl Dees.
Anyhow, I'm on the phone with you.
You're on the phone, you're on the radio.
Yes, you are.
And so we hope you meant to call the radio station.
Yeah.
It's not a Liesl butt dial.
Yeah. Or are you picking up your dry cleaning today? Yeah, okay.
I am not. No,
Okay.
I told you intentionally because I want to give you an update on the Want to Help line.
Perfect, Liesl. Well, we're glad that you called to do that. And how are things going with the Want to Help line?
So we have gotten some new updates for things, and just to put the word out that we continue to look for new updates. And specifically, we've gotten a couple of new needs related to the Navajo Nation. And I'm beginning to see more things like on social media, whatnot, of other kind of needs and organizations. And we want to make sure that we're working with reputable organizations, that we're promoting things that have a true need. And one of those came from the Navajo Nation this week. They have put up a website that is www.nndoh.org/donate-HTML. So you can go online to that and find it, or you can go to the City of Farmington's Want to Help page. Type in Want to Help at the City of Farmington or go under Coronavirus Resources, and you'll find our spreadsheet that has all of this information on it, so you can find that URL and don't have to go running for a pen.
Okay, very good.
I ran for a pen, so we can repeat that link.
We can, which is
Right.
good.
You want to repeat it, Megan?
Sure. nndoh.org/donate.
There you go. Perfect.
Yes, and I think I had to type in that .html at the end.
Okay.
To get it
Okay.
to work for me. Mm-hmm.
Old school.
Very good. And
Yep.
so Liesl, again, the website is still compiling some of these needs and things as well, correct?
That's exactly right. So the Want to Help line is looking for things like this that give some ideas for our community as to how they can help others. And the Navajo Nation has done a great job of listing out immediate medical needs, and it's a long list of things like N95 masks and ventilators, but also non-perfumed hand sanitizer, disinfecting wipes and sprays, alcohol-based cleaning wipes, thermometers, goggles and eye protection. So some very specific things, portable pulse oximeters that are handheld, for example. Okay, and then they also have community needs listed. They have disposable masks and cloth fabric masks, and they have a mailing address where they have a special call for homemade cloth and fabric masks, which can be sent via FedEx or UPS, and they've got an address for you.
Okay, very good. And again, if folks still want to help, they can call that Want to Help line number, right?
Exactly. So if you call the Want to Help line number, we'll share with you the information that we have from the spreadsheet, so you can go online and find that. But if you're someone who wants to help and perhaps you're not seeing something specific that fits your abilities right now with the on what's online, or if you don't have access online, please give us a call to the Want to Help line, and we have been finding ourselves in some situations where we have gone back to people who have called us before and reached back out to them.
Great.
So the Want to Help number is 566-4210. That's 566-4210, and we staff that Monday through Friday, 8 a.m. to 5 p.m. And unless there's a phone glitch, you'll get someone to talk to, or we'll call you right back if there is
Okay.
an issue.
Very good. Yeah,
so
go ahead.
Let me just give a couple more things from the Navajo Nation website.
By all means, please do.
So some other community needs include pet food, hay and feed for livestock, and I understand NAPPY has been involved with hay and feed for livestock too, baby necessities, non-perishable food, thermometers, paper products, liquid hand soap and hand sanitizer, cleaning supplies. These are all things that they are looking for. And we also have listed on the Want to Help line, there's a Navajo Hopi Relief Fund that is also working on the reservation, and they have a particular need right now for deep freezers. So if you have a deep freezer sitting in your garage that is not in use and that is something that you would like to share with people, they are using those for temporary storage while they are doing food distribution, kind of doing that food distribution around the closure of the Navajo Nation, the curfew on weekends.
Okay.
So
lots of ways to help, it sounds like.
Exactly. And I think one of the things that we're seeing happening, and I suspect we will continue to see, is that needs evolve, and perhaps some ways in which you wouldn't think that I've got, for example, a CPAP machine that's unused, and the hospital has been asking if you have an unused CPAP machine, that's not being used right now, that they would welcome those as donations.
Great.
So some things that maybe you haven't thought about, and also if you just have some extra time and you don't have a lot of commitments right now, if you have availability, check out some of the things that are on the list and see if there are things that you think would be appropriate for your skills and your life situation.
Exactly. And again, the list, and we've been asked to put the link on in our chat under the program here once we're off the air, which we will do, everybody, but it is through the City of Farmington's website, correct? The fmtn.org?
Yep.
And
if you go to the fmtn.org and then you look for the coronavirus information there, and I'm doing this myself right now.
It's play-by-play from Liesl Dees.
Yeah.
I like it.
Color. I'll do the play-by-play. So there is a specific coronavirus piece, and then on there is a Want to Help line link.
Okay.
Among about a half dozen links that are on there.
Perfect. But fmtn.org will get you started, and then you can kind of look for it from there. But we'll put the exact link on the program as well, Liesl. So thank you for calling in with the update.
You're welcome, and keep sharing that positive information, and hope you guys have a great day.
We will do that. Thank you very much. Liesl Dees, of course, from the Community Learning Center here at San Juan College, and putting together the Want to Help line, along with some other community partners, too. The City of Farmington, of course. I think San Juan County is involved. San Juan United Way is involved, and the San Juan College, of course. So, good thing.
Right. Teamwork.
Yep.
Very good. Well, great. Liesl, thank you. Stay well.
You're welcome. You too.
Okay.
Bye now.
Bye-bye. Liesl Dees calling in, and we appreciate that. And we're going to go to another caller.
Great.
So let me see
who it is.
Who it is.
It's a mystery caller.
It might be a mystery
it could
caller.
Be. Probably not.
Let us
but
see
maybe.
here on KSJE. Good morning. You're on KSJE.
Hey, good morning, Scott and Megan. It's Jeff Bourgeois.
Jeff Bourgeois from the San Juan Regional Medical Center, of course, CEO. Thank you for calling in, Mr. Bourgeois, and we appreciate you doing that. And can you give us an update of conditions at the hospital this week?
Yeah, I sure can. Scott, we have a total census today of 103. Two of those are patients pending test results, and neither of those is intubated. We have 21 positive COVID patients in-house. 5 of those are intubated. So we've seen really, about a week ago exactly, if I'm looking at the chart correctly, on April 20th was kind of our high water mark. We had about 45 or so patients between positive and pending, those pending test results in-house. And so we're almost half of that as of today. So we've seen the trend line show a general softening of the total combined COVID population over the past week.
And is that something that we should then take as maybe, it sounds like good news. I shouldn't say anything against that, Jeff Bourgeois, but I mean, is that something that, how much can we interpret these numbers, I guess, into hoping that maybe we've seen the surge and maybe we're on the down slope of this, or I don't want to get ahead of ourselves?
Yeah, I think it's good to be cautious, Scott. This is such a new event for the entire country. We certainly hope that we've passed our peak of hospitalizations anyway, and we're watching it. We think by the end of this week will be really informative to see what develops this week. So a week from today, when we talk, we'll have another week's experience under our belt, and maybe more of a trend line to feel comfortable about what our hospitalization trend is going to look like. Yesterday there was a testing event in town sponsored by the Department of Health, and there, as I understand it, now this is an unofficial word that's been passed along to me. So if someone from the Department of Health has more accurate information, I would certainly lean to their statistics. But I'm told 496 specimens were collected there, and so what that's going to do, Scott, undoubtedly, is show a sharp increase in the number of new cases diagnosed here in San Juan County once those results are reported, which should be a day or two.
Right.
And they're going to repeat that testing event today. This is over at McGee Park, and it's really
yes.
So
we've talked about that earlier before you called in, Jeff Bourgeois, from 10 till 2, and I think that's what a lot of folks have been saying. In order for us to get a handle on just how many folks are sick, or maybe at least just maybe asymptomatic but infected, we need more testing, and that's, I guess, what these events are trying to do. Correct?
That's correct. So I think it's good that the Department of Health is doing this. Applaud them for bringing the resources up here. I think they were in Gallup late last week, and I understand they'll be doing a similar event in Shiprock at some time later this week. So I think that's helpful to give all the scientists and epidemiologists who are really studying what's going on up in the northwest corner of the state a better picture. So I would caution our local public not to be concerned when they see the numbers go up. When you test more people, you're bound to find more positives, right? So that's not necessarily a bad thing. It's helping us with more information, more data points, so we know exactly what the circumstances in our local community. If you were to go on the Department of Health's website right now, I think there's a way to get down to the testing results at the county level, and I believe it indicates that we've, to date, about 16% of all test results in San Juan County have been positive. So, I mentioned that.
Right.
So if we had almost 500 people, you could assume that we'd have almost 75 new positives if that trend line is still holds true. So again, and we're doing that again today over at McGee Park. So we'll see some big numbers coming out for San Juan County this week. But again, I want to caution everybody not to be overly alarmed by that. Just be glad we have the information, and let's give our scientists and clinicians time to really understand what that means. But again, encourage everyone. If you're waiting on a test result, or if you are just out in an essential worker and out in the public, wear a mask, practice social distancing, and let's get this curve flattened and get on the other side of it.
Great. So understanding that I think the ultimate goal is to test as many people as we can. Yesterday and today at McGee Park was really centered around essential workers. Are we hopeful, since we have, you said 456 people that were tested yesterday, that maybe more tests would be coming down the pipeline for people who are not essential workers, that we'd be able to expand the test pool?
Megan, that's a great question. I think what we're hopeful of is to be able to do more widespread testing and eventually antibody testing. But there's again, with this being a novel virus, the scientific community and the clinical community is still putting the pieces of the puzzle together to get a more complete story of exactly what we're dealing with here. So, just watching the various news outlets over the weekend, does a positive antibody test indicating that you at some point in the past had the disease, does that in fact mean you're immune or not? Typically it would, but we've got to validate that with this new virus. So It's going to be important for us to understand as much of that as possible as the state and certainly our local county begins making plans to reopen the economy at such time as the governor's public health order is lifted.
So if one were to test positive and they were asymptomatic, the assumption is they're still shedding the virus, right? But how would you just self-quarantine again for 14 days, or what do you do? What are they expecting people to do if they test positive but they're asymptomatic?
Well, I believe they would recommend you quarantine, shelter in place from 14 days of the specimen being collected. So, in other words, if you have to wait 3 or 4 days to get your test result, you don't start the countdown to 14 days at receipt of the test result. You assume you start that period at the time the specimen was collected.
Great.
Very good. And Mr. Bourgeois, again, going back to what you told us about these numbers that may be going up here with all these additional testing, and I think it's important to remind all of us that even though the numbers of positives may be coming in, they still don't necessarily require hospitalization, and that's where your information is so important when you tell us every week of what your census numbers are and just how many patients you're seeing. And so it's possible to test positive, and even as Megan was saying, you can self-quarantine at home, and you don't necessarily need to be hospitalized. And that's really an important distinction, isn't it?
It is very important. Again, it's kind of the 80-20 rules. What we're hearing is that 80% of the patients have a relatively mild course of illness, and 20 have a more severe course. So I'm looking at the current stats on the Department of Health website right now. And certainly we're not the only hospital in San Juan County with Northern Navajo Medical Center treating a number of cases, but there's been 442 cases reported so far, and we've only admitted 90.
That's an important distinction, I think. So yes.
Yeah.
Very good. Well, Mr. Bourgeois, we appreciate your time each and every week giving us an update, and we hope we can have you call in again next week if you don't mind, and we'll be talking to a couple of your doctors later on this week too, so we appreciate that.
Yeah, they are really outstanding individuals. I think your audience will learn a lot from them, and they're continuing to research. They're doing reading daily and really trying to understand what literature the medical community is putting together to help advise everyone going forward about what's the best path forward.
Right, and as we were even talking about before you called in this morning, there was some new, I think, guidance from the CDC about maybe some new symptoms and some new things that we're learning about. It seems like information is changing almost on a daily basis, and I know your docs are trying to stay up to speed on all the latest stuff to watch for and to help for folks to recover, and that's important things to share, I think.
I agree. Yeah, I think there were 6 new symptoms that they said CDC said to watch. But I would also encourage somebody, if they've had a test and they're negative, but they are still somewhat symptomatic, any of those symptoms that the CDC reports, fever, difficulty breathing, shortness of breath, cough, chills, shaking with chills, etc., headache, sore throat, still wear a mask, still socially distance, because we do know that there is a certain false negative rate with the testing results, and we don't know necessarily what that is on a local or national basis, but I will tell you that that risk certainly exists, that if you had a negative result and you're symptomatic, you might have had a false negative, so still protect yourself and those around you. Good
advice. And we've seen the graphics and information about if all of us are wearing masks, we're more protected. And if we're wearing a mask, we're protecting others. But if they're wearing a mask too, I mean, it just increases the protection as you're out in public. If you need to go out, and again, you shouldn't need to go out as much as we are, is the point. So, Jeff Bourgeois, thank you for calling in. As always, appreciate it very much.
Well, thank you all for giving us a voice and helping us get the word out to the community. Appreciate you.
You're very welcome. Thank you very much. Stay well. That's Jeff Bourgeois, the CEO of San Juan Regional Medical Center, calling into our COVID-19 local information program, which is what it's all about, local information, right?
That's what it's all about.
And knowing about the numbers of patients hospitalized at our local hospital is, I think, very important to know.
It is. It's always comforting to know, too, right? We're not maxed out. I feel like it's a nice quelling of possible hysteria.
Well, hopefully, right.
The quelling of the hysteria. That's what.
And God forbid we need it, but we have the capacity if we do. So that's important. We do have another caller standing by this morning. So let's go to the phones. Good morning. You're on KSJE. Thanks for calling in.
Yeah, Mr. Guest number 2. Good morning, Scott. It's Devin over the county.
Devin Neely, San Juan County. Good to hear your voice.
It's good to be here with you folks this morning, even if I'm not there in person. And I know that you folks have spoken at length about the external testing clinic that's going on at McGee Park here in about 20 minutes. And I wanted to update you that is still going on today from 10 o'clock until 2. And that is expanded testing for essential workers and folks with symptoms and anybody that qualified for tests before, and now we're adding in essential workers and those who have contact with those who have tested positive and some other people like that. And so if you believe that you need to be tested for coronavirus, you can go to McGee Park from 10 o'clock until 2 today, as we did yesterday, and receive that test. Yesterday we had 496 tests out of about 1,000 test kits that the Department of Health has in this area, and so they will be cutting off the line today, as they did yesterday. And so, if the earlier you can get over there, the better. We found that there are some rather long wait times, and so we provided some traffic control over there from the San Juan County Sheriff's Department, and as well as some facilities that folks waiting a long time might need to use the bathroom. They have that opportunity now, but as I understand it, there is already a line over at McGee Park, and that testing doesn't start for another about 20 minutes.
Okay, good to know. And I guess the numbers, though, were folks a little surprised by the numbers that came out yesterday for this event, Devin? I know, when you plan these things, you never really know how many folks are going to be taking advantage of it, but it sounds like the numbers were pretty large.
I don't think that caught the Department of Health off guard. As I mentioned, they had 1,000 test kits, so they're well prepared, and that's about half their supply for a 2-day event. And so, they did cut off the line, and so I know that they were turning folks away there towards the end, so that there were enough test kits for today.
Okay.
But there is obviously a demand, and so. When these expanded test clinics are available, we know that a lot of folks are going to get tested, and for me, that was no real shock that they had that kind of a volume. And as I understand it, there was an hour's wait time at times yesterday to get tested, and that doesn't surprise me at all.
Sure.
The Department of Health provided all of these personnel and these test kits, and so we're just trying to get the word out, but it is a valuable service that they're providing.
Definitely, very much so. And I'd heard from someone who went through the test yesterday that it was fairly efficient once you got through that line. That once you got through it to roll your window down and talk to somebody, the actual process was fairly efficient to get you kind of in and out and to give you information about how to get your results. So I think that was a good thing, and it kept things moving along, even though there were a lot of people. Folks felt like they were moving through as quickly as possible.
Yeah, definitely. At this point, this isn't the first rodeo.
No, I'm afraid not.
So
right.
I think the Department of Health has really learned to make those test clinics as efficient as they can be, just like San Juan Regional Medical Center has too. They have test clinics not daily, but every week, and they're processing a lot smaller volume, but that's still available and still an efficient way to get a test. So
very good. Well, Devin, we appreciate the update this morning. Thank you very much for calling in.
Certainly, Scott. Thanks for having me. You guys stay healthy.
All right. You too. Thank you very much. That's Devin Neely from San Juan County. Again, those tests are out at McGee Park from 10 until 2. And if you feel that you're part of one of these essential groups and want to go out and get a test, for peace of mind or whatever reason. If you have symptoms.
Social responsibility.
Social responsibility would be another one, sure.
Right. Right.
You can get out there, and I would say probably the earlier you can get out there, the better, since they are talking about cutting off the line.
Well, they did cut off the line yesterday.
For you.
For me, yeah. I got there at 12.
And others.
Yeah.
And that was still 2 hours to go.
Right.
So good point.
So pack a lunch.
Right.
Get a book on tape.
Something. Listen to KSJE.
Listen to KSJE.
There's that.
That's a better option.
If you have a radio in your
Go
car.
with that.
Yeah. There you go. But anyway, I think we all agree that the more tests, the better to be able to know just how many folks we have in our community that are infected. And because if you know, then you can do that self-quarantine. And
That's
then you're not out breathing on people.
You're not out of,
yes. We don't want that.
Because we don't want that for a lot of reasons.
Right.
But yeah, the 6-foot radius, I mean, and it's hard to eyeball 6 feet. I mean, I think there's a lot of folks that are...
I'm going to get you one of those hats with the pool noodles.
With the pool noodles.
So you can just walk through the community and know.
I'm not saying it's hard for me to eyeball. I'm just saying categorically it's hard to eyeball 6 feet.
Understood.
But yeah, I mean, other states are mailing tests at this point, particularly like Seattle, that Seattle area. I heard the other day that they were mailing it at random, looking through the census. So there is, I think there is a long-term goal of just making it one of those things where they may, like, you go to the doctor and they swab you for the next 2 years.
Right. Well, we've heard about, if we are going to start reopening the economy and stores and things, that people need to get their temperature taken when they go inside a building.
That's right.
And that may be the new normal for a while until we figure out
it's a strange thing.
What else is going on. But
yeah.
But more tests are a good thing.
They are a good thing.
And as Mr. Bourgeois said, when we see these numbers spike, because we'll probably see a lot of positives from these tests, and if we're doing 500 a day, that's going to be a lot, perhaps.
Well, didn't he say 16% of tests come back positive, right?
Right.
So again,
do the math.
I'm not going to do 16% of 500 is like
right.
I'll be working on that for like 2 hours, but
right.
16% is high.
Yes.
So it feels high.
It would be probably, what would that be?
Oh God.
About maybe.
I thought we agreed we were going to try this.
75.
Yeah.
Let's go with that.
Let's go with that.
Yeah.
More than 50.
Yeah.
There you go.
There you go.
Okay. Cool. We're getting there.
Yeah.
We're getting there.
10% plus 5% would be about 75.
Okay. Cool.
See?
Good
that
job.
was in my head. And I even kept my shoes on to figure that out. So.
Yeah. Good job, Scott.
Okay.
Cool.
There you are.
Cool.
But we appreciate everyone tuning in and calling in to share information. Again, if you would like to call in the last few moments of the program today, we invite you to do that at 566-3909 and let us know how you are putting up with all the social distancing, the physical distancing, if you're working from home, if you're putting the kids through school at home. If you've got some tips, let us know. But, of course, there are lots of great resources I know that have been on the Facebook pages. We share this program on several Facebook groups, and we appreciate that because it gets the information out to more people.
That's right.
So that's important. We do have a lot of other things planned for the week. As Mr. Bourgeois said, we're going to talk to some semi-regional medical center doctors.
The docs.
On Thursday. And I know you have a lot of questions. You always have a lot of questions for the doctors.
I have so many questions for the doctors.
Some related to COVID-19.
They're mostly related. I think, okay.
Yeah.
And infectious disease in general.
Of course. Right.
Right. No. Antibodies, I'm like obsessed with that these days.
You are, right.
Plasma, I'm obsessed with that. You'll see what I mean later.
Right.
So.
And that's another form of testing, right? This antibody test that we hear about
the antibody
to
test
let you know if maybe you had it, and you don't have it anymore, or you don't have the symptoms anymore.
That's what it is. Yeah, it's a very important. It's testing whether or not you have immunity.
Right.
Which, of course, they don't know yet whether you can get reinfected, like whether your immunity is a permanent thing or not.
That's right.
But that's huge. The plasma thing is for people who have survived COVID-19. To donate plasma to people who are still fighting COVID-19.
Right.
Now, that is some fascinating stuff, particularly since the infection rate, they say per one infected person, they could infect 3 people at least. Mm-hmm. And the plasma that they're doing, those donations, which again, it's an experimental phase. FDA has approved it for crisis situations, not for like universal use yet.
Right.
But each amount of plasma from one individual could help save 3. Look at
that'd be cool.
Yeah, that symmetry, right?
Yeah.
It's kind of
interesting,
beautiful in a weird way.
Yeah, very much so.
Yeah.
And I imagine a lot of this has to do with maybe trying to come up with a vaccine or some other treatments, because again, a lot of these things that we are hearing about in our hospitals for folks who are the most sick aren't always successful, tragically. So it's important that we get some ideas.
There seems to be a parallel thing going on, treatment and vaccine going on,
So we hope that
Yeah.
moves forward quickly, as I'm sure it is. There's a lot of
Yes.
folks they're working on this. So
Round the clock.
there you go. All righty. Well, I think
Cool.
should we stick a fork in this show?
We probably should.
Okay.
Yeah.
I guess we should. But
We'll
it's
be back
always
tomorrow, though.
great to visit with everybody
Yeah.
and to come together as a community. Again, we are doing this show Monday through Thursday at 9 a.m. live on KSJE's Facebook page and YouTube channel. You can hear it again on the radio every afternoon at 5:06 on KSJE. KNMI is also broadcasting the audio portion of this show at noon at Vertical Radio 88.9 in Farmington. They have other translators around as well. So we appreciate that support too.
Yes, absolutely.
So
Teamwork makes the dream work.
that's what
Particularly
you
during the
keep telling
time
me.
of COVID-19.
That's true.
That's what you keep
right.
telling me. It's true.
The team will be back tomorrow, everybody. So
Yes.
until then, stay well and stay safe. This is KSJE.